Vaccine could soon be on its way, too. It's from Johnson & Johnson. Our next guest is one of the participants in that trial.
That next guest is Ohio Republican Senator Rob Portman, joins us from Capitol Hill. Senator, good morning to you.
Hey, Steve. Good morning.
It's good to have you. I know you, like many people, feel like vaccines are the single most important thing we can do to get the country back on track. You got a briefing. You heard that it was tough to get some people to sign up for this unknown vaccine. So how'd you get involved?
Well, at the briefing that I had from a company in Ohio that organizes these trials around the country, I found out that they were having a tough time getting more people to join the trials. And more people in the trials is a good thing because that gets us quicker to an FDA authorization process and a vaccine more quickly. So I said, what the heck, should I sign up? And they said, sure. And if you'd be willing to go public with it, it would be helpful to get more people to be able to join. Second, as you said, I just think these vaccines are the critical, important next step. I mean, we're not going to be able to get through the coronavirus and back to a normal life, I think, until we get those vaccines. I'm for masks. I wear mine. I'm for social distancing and more tests, but we really need to have these vaccines. And this is really exciting news this morning. By the way, the other reason I wanted to do it is that I have been very concerned about the numbers I've seen on people's willingness to get vaccinated. So by going through the trial,
they're low.
It's very low. You know, when I got into this, it was 50%. As of last night, it's now up to 56% of Americans are willing to get vaccinated. We need everybody to be willing to get vaccinated who doesn't have a medical issue, because this is going to protect them and their families, but also our community. And, you know, I applaud the administration for what they've done here. This Operation Warp Speed, public-private partnership, is really working. This is a great, innovative way for us to do something that's never been done before. Never this quickly have we gotten an effective and safe vaccine to the American people. So great news this morning from Pfizer.
What did you think of Governor Cuomo's comments about rushing this? He said that it's all about money and ego. He was concerned with how quickly this vaccine is being administered.
Ainsley, I'm very concerned about politicians who are suggesting that somehow the scientists at the FDA are not doing their job. They're impugning the integrity of a great group of Americans who have worked day and night to ensure we have this vaccine ready. So whether it's Governor Cuomo or some of my colleagues in the Senate who are being skeptical about this and giving people a sense that this might not be safe, that is really irresponsible. It's playing with the health and safety of the American people, really, and playing politics. So I hope that everybody gets on board here. And yes, it is the Trump administration, but yes, they've done a great job with Operation Warp Speed. And these are scientists at the FDA. These are not politicians. These are the people who do the best work in the entire world. And we need to trust them, and we need to help America to be able to turn the corner here.
Senator, no kidding. You used to have the checkbook for the country. You know what the president had to do to get through the bureaucracy. You know, to get the military ready to go, to get FedEx and UPS ready to help. And in order to do that, he had to buy the vaccines ahead of time. So talk about how new this is. And you do have to give credit to the administration. Am I right? You used to be OMB director.
Yeah, I'm the former director of the Office of Management and Budget, as Brian suggests, and the bureaucracy is sometimes difficult to get through. What the president and his administration decided to do was to go ahead and spend the money now to begin the manufacture of these vaccines, even as they're going through the testing process. And if at the end of the day they don't get the emergency use authorization from the FDA, they'll be thrown away. On the other hand, if they do get through it, and it looks like these first two, both Pfizer and Moderna, are doing very, very well, then we can immediately begin distribution because they would already have been manufactured. It was brilliant, and otherwise we'd be looking at months and months.
That's right.
So it's a good plan, and it's working, and the American people are going to benefit from it.
Real quick, final question. So you got the vaccination. Any side effects? Did you feel okay after you got the shot?
Yeah, I mean, your arm hurts a little bit, but you know, it's a very thorough interview process you go through. You got to reveal everything about your life. You got to be sure your own doctor, if you have one, is on board. You got to go through a daily diary for the first week, or you tell them exactly how you're doing, take your temperature, and so on. But it's not hard to go through. And then right now I'm checking in every Monday and Thursday with a healthcare report. I encourage people to sign up. I mean, I think it's a way for us all to do a little bit to help here, our civic duty. And when the vaccine's available, because it will be safe and efficacious because of the FDA following the process. By the way, this emergency use authorization process has been tightened up to deal with the coronavirus. In other words, it's even more strenuous than it was before.
Good.
So I think this is a really great opportunity for us to get back to a more normal life, to get back to work, get back to church or your other place of worship, get back to a more normal life. Absolutely. That I think everybody's desperate for.
Senator Portman, thank you so much. God
Thanks,
bless
Ainsley.
you for being one of these volunteers saving other people's lives. We appreciate it.
Thanks, Ainsley. It's easy, and thanks to you guys. You guys are always so upbeat. Thank you. Take care.
Thank you.
Thank you. We try.
That's
Okay,
the
let's
coffee.
hand it over to Janice.